I'm Lisa Miller. I am the CEO of VIE Healthcare. I'm here with Brian Covert, who is Managing Director and also Senior Analyst at VIE Healthcare. And we're going to talk today about VIE's approach to physician engagement, which we think is a little bit unique. We get comments all the time from our clients saying that they're very surprised about how we're able to engage physicians in our cost reduction initiatives and how successful they are, that it's not an obstacle for us in getting physician buy-in and engagement. And so today, kind of want to have a conversation, Brian, with you as to why you think we're able, to really work so collaboratively with doctors and get them engaged on these initiatives.
Sure. I just think it all starts with the fact that physicians are very intelligent, and if you lay out the information for them clearly and directly, typically they'll buy into the direction that's best for the hospital. So when we start with the physician engagement, we always start with the information. We'll analyze 12 months of data, and then we'll stratify it by physician, by manufacturer, by reimbursement type, and we'll lay all of that out into a nice, clear visual presentation. It's not directed at influencing physician preference on which items they use in surgery or which instruments they use or supplies that they buy, but rather just strictly informing them of these are what you're using, this is how much it costs, and this is how you're typically paid back for those items. And then from there, it's usually pretty clear what the best direction for the hospital is. And as long as that is laid out clearly and honestly, usually they buy into the initiative as a whole.
Yeah, I would agree. The way you establish that presentation so methodically, first with looking at the 12 months of history by physician, by DRG, comparing it to reimbursement, and laying it out in such a way that it's just displaying the information or providing the information versus influencing, I think is a very important part of our process. And so the physicians are, they're scientists, they see the numbers and the information, and they're looking at how they compare amongst peers and also wanting the hospital to achieve profitability. And so I think the way that that's laid out offers them a visual way to say, okay, this makes sense, I'm in agreement, I agree with your process to do X, Y, Z, or to negotiate. And I think you and your team have done an excellent job at showing that data. VIE Healthcare has a different approach to engaging and collaborating with physicians. Please invite us in for a conversation so we can discuss opportunities to collaborate with you and your physicians to achieve cost reductions and cost savings in your hospital.